Doctors and nurses of Reddit, what have been your "why didn't you come in sooner" moments? Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. She hadn't been in for an exam in almost 2 years. So the doctor asked that she come in to be evaluated before a prescription could be given. She refused and called again the next day asking for a prescription. This went on all week. Her calling for pain meds, the doctor asking her to come in to be seen. She finally agreed to make an appointment. It wasn't shingles. It was a skin ulceration from advanced breast cancer. Maggots. Whenever it's gotten to the point of maggots, it's like 100 alarm bells that this person's living situation is no bueno. A&E Ed doctor here. A farmer in his 70s reluctantly came in with his wife after falling over outside while wrangling a sheep 1 week earlier. He did not want to be there but had been forced to come by his wife, who was worried about him. On examining, he was pale, short of breath, and clearly in pain all over the right side of his chest but not wanting to show it. X-ray and blood showed he'd broken loads of ribs, punctured his lung and bled profusely into his chest and was now very anemic. I've seen a few over the years, and they generally fall into the category of, if it's not diagnosed then I can't have it, or I didn't think it was that bad. As a medical student, I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years, but if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category, I've seen a few cases of Fournier's gangrene. Pretty much obese male diabetics that had a pimple sore that started in the pubic region. By the time they come to the hospital, it's a raging infection where the treatment is basically to cut away everything in the pubic groin region down to the muscle layer. That little sore didn't seem like much at first. We once had a patient who went to emergency for abdominal pain and they discovered a fungating breast wound. Don't image search that she'd had for 2 years and hadn't gotten medical attention for. A biopsy and a PET scan later, she was diagnosed with breast cancer with extensive liver, lung and bone mets. This was also in Australia, so it wasn't a money issue. Just sad. Had a patient brought in by her son, took care of her. When she arrived to our unit, I performed a skin assessment, took off her socks and found a fallen off gangrenous toe. Seems fake and I wish this was, but it was by far the nastiest thing I've witnessed. Son said he had no idea when his mother's foot became that bad. No words. Not a doctor, hospital staff. But my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one of his mules when something spooked it and he got kicked in the gut. He was in a lot of pain, could barely move due to the abdominal pain, so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge, like volleyball size huge, and he may have survived if he came in sooner. By the time we got him to the hospital, he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. Story from my sil, who is a nurse. Young man was brought into the ER. He had a sinus infection that he had let go to the point that it had eaten through the skull and into this brain. She was told that it had started several months before. He didn't want to go to the doctor for it. All it would have needed was 10 days of antibiotic pills. Instead, he was not brought in until he was unconscious and died within a few hours. Children's nurse here. My first week in pediatric ed, we had a young girl, 6/7, come in with a really swollen jaw, face poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mom told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the GP as they thought she was just messing about to get out of school. My cousin is a pathologist assistant and was telling me how she had to dissect a testicle that was 11 pounds. Turns out it was testicular cancer. Elderly woman fell at home and broke both femurs. Son thought she just needed to rest, so he carried her to her bed. She lay there in her own filth for 3 days before anyone called 911. The son lives with her, and there's family next door as well. How? Why? I had a patient come in saying he couldn't see. How long had it been going on? For 5 days. The man had been blind for 5 days and didn't come in because he thought it might be like a cold or something. During the exam, when I asked him to move his legs, he said, "Oh, I can't do that." I asked how long he'd been unable to move his legs or walk. Wife chimes in, "About 2 years. Never saw a doctor about it, they just borrowed a friend's wheelchair and kept it rolling." Turned out he'd had multiple strokes with multiple risk factors he never addressed. Given how little insight he appeared to have into the condition, I honestly felt sorry he didn't have insurance, so I'm sure that played a role in him avoiding seeing anyone. I was working as a surgical junior when my team was called down to A&E to see a patient who had come in with a complication from a recent hernia operation. When we came down, we saw that the patient was holding a plastic bag over their abdomen. When this was removed, we found that their wound had opened and their intestine was visible to the air. It transpired that this was not something that had happened overnight. It had taken several days. The patient had started using plastic bags and newspaper to dress the wound when they ran out of dressings. My girlfriend is a care worker and she recently told me that she slipped off a patient's slippers and remarked, "I didn't know you had lost your toes," to which the patient responded, "Well, I hadn't till you took the slipper off, dear." Sounds like something from a grim sketch show. God bless anyone who can do jobs like that. My dad is the one that wouldn't go in. He got a sore in the crease on the bottom of his second toe, the one next to the big toe. So it would be the piggy that stayed home and just kept ignoring it. He would go with his wife to her nail place and have his toenails trimmed, and I think that's where the infection probably got in when they soaked his feet. He blew it off for a couple of weeks until the wife made him see the doc. It's a good thing she did. The infection had gotten into the bone, so they had to snip his toe off to the first knuckle to catch it before it went any further. The doc said had he waited any longer, he could have lost the entire foot. He's lucky to just have a stubby piggy and not a stubby leg. Not a doctor or nurse, but worked as a doctor's office assistant. A regular patient, who was very sweet but unfortunately had an ongoing battle with alcoholism, was brought in by his roommate, and I knew instantly that he would be dead soon. I'd seen some jaundiced humans in my time there, but this man was a yellow I never knew was possible. His roommate said, through tears, "I've been telling him to come in for weeks." And the patient kept telling roommate to relax, that he was fine, majorly in denial. I helped him to the exam room, and when the doctor entered the room, he immediately asked me to go call an ambulance. A few weeks earlier wouldn't have helped, but perhaps the end could have been made a bit easier for him. He died 7 days later in the hospital. Hit me very hard because I'd known the guy for a few years. Sometimes he would be sober when he called, and sometimes he would be slurring and completely incoherent, but he was always kind. I work in orthopedics. A very common occurrence is a patient is told to follow up within the week. We like to see fractures between 5 to 7 days. And the patient will call on the 6th day and say, "I broke something and need to be seen tomorrow." This is frustrating because we very rarely have the ability to get a patient in next day. And if they had called the day of or the day after, then we definitely could have gotten them seen. But my number one, "Why didn't you come in sooner?" moment was getting a call from a patient who had broken their forearm 2 months ago and never followed up. I got them scheduled. They no-showed their appointment. Rescheduled. They no-showed. Second reschedule. They arrive with a very obvious deformity to their arm due to the fracture healing incorrectly. If they had just come in, it wouldn't have been an issue at all. Blows my mind that they went almost 3 months without care. Not a nurse doctor but a lab scientist had a guy come in at the end of the day for chest pain. That's been bothering him all weekend. The doc ordered a troponin blood test which helps rule in out heart attacks. If the test runs above 0.03, we consider that a sign for a heart attack and act accordingly. This guy's very first troponin was 21.00. 21. The highest we've ever had up till then was an 8.00. The guy should have been dead ages ago. But he somehow pulled through. Don't ignore chest pains, people. Edit. Just want to clarify that the hospital I work for is a tiny ass 25-bed, rural community critical care hospital. Definitely not a place with dedicated cardiologists, cath lab, bedside assays, or even a big test menu. Period. Bare basics. And the guy did, somehow, end up surviving. Not a doctor, but was this patient once. My sophomore year of college I started drinking coffee. And, as college students can be wont to do, I drank a lot of it. One evening, during midterms week, I get a bad headache. So I drink some coffee and settle in to churn out a few hours of work. My headache goes away, but I start noticing tingling and numbness in the right side of my body. It eventually gets bad enough that I can feel the line down my face where the tingling ends. My whole right side is totally numb, but I think it's midterms week, and I probably just need to sleep it off and it'll be fine. Right, so I go to bed, wake up for my 8 a.m., and the numbness is all worse. Eventually, at like 10 a.m., I finally asked a friend to drive me to the ER. The ER doctor was horrified that I had ignored a very obvious sign of a stroke for at least 12 hours. It ended up being a complex migraine brought on by, essentially, a caffeine overdose and sleep deprivation. I adjusted parts of my lifestyle, including monitoring my coffee intake, and haven't had a repeat episode. Obligatory. Not a doctor. I was sitting in a hostel with an emergency nurse and an emergency doctor that had just found out that while they worked on different continents, they did similar work. We were happily chatting along and this older guy walks in. He overhears that they're in the medical field and comes up to see if he can ask a question. He shows them his leg. That's got large black spots on it everywhere below the knee. Both the nurse and the doctor look at it and immediately go, "You have to go see emergency services. That leg is necrotic. You'll lose the leg if not your life." And the guy goes, "Huh. That's what my doctor back home said too. But the leg feels fine. I'd know if it was dying." "You are wrong. Besides, I'm not gonna ruin my vacation by seeking medical treatment." Quote, which left me wondering why he asked in the first place. He goes to sit at the bar and over the course of the evening both the nurse and the doctor leave the table to try to get this guy to understand that he may not have 10 days until he's back home. That he needs to have this looked at now without success. Pretty sure that if that guy made it to a hospital, they asked themselves that question.
If you enjoyed this video, please check out our playlists full of similar content. Epicaricast is like doom scrolling for your ears. Please like, share, and subscribe.